Plastic surgery has evolved significantly in recent years, influenced by social, technological, and cultural factors. This evolution includes the impact of the COVID-19 pandemic, the rise of selfies, cultural dynamics, and the Brazilian butt lift (BBL) phenomenon, zoom face, and the pandemic influence. The COVID-19 pandemic has led to a notable increase in interest in cosmetic procedures, a trend often referred to as the zoom face phenomenon. With the shift to remote work and frequent video conferencing, individuals became more conscious of their appearance on camera. This awareness resulted in a surge in demand for procedures aimed at reducing wrinkles, smoothing fine lines, and restoring volume to cheeks and under-eye areas. Non-surgical options, such as Botox and injectable fillers, have become particularly popular. Additionally, the pandemic provided people with more disposable income as they were unable to spend on vacations or other activities. This shift in spending habits further fueled the demand for cosmetic procedures, making them more accessible to a broader audience. The impact of selfies. The rise of selfies, especially those taken at close range with smartphones, has contributed to the increase in plastic surgery requests. Selfies can distort facial features, making noses appear longer and chins shorter, leading to body dissatisfaction and a desire for surgical correction. This phenomenon is particularly prevalent among younger individuals who frequently use selfies as a reference for their desired appearance. Social media platforms, where selfies are often shared and scrutinized, have amplified this trend. The constant exposure to idealized images can create unrealistic beauty standards, prompting individuals to seek cosmetic procedures to achieve a similar look. Cultural and social dynamics. Cosmetic surgery has become more normalized and less stigmatized over time. In the United States, the popularity of cosmetic procedures has grown, especially among women. This trend is driven by societal pressures to conform to certain beauty standards, which often emphasize youth and specific ethnic features. As a result, cosmetic surgery can sometimes perpetuate ageism and racism by promoting a narrow beauty ideal. Despite these issues, the normalization of cosmetic procedures continues, with many viewing them as a means to enhance self-esteem and personal satisfaction. The acceptance of cosmetic surgery has also been influenced by the portrayal of beauty in media and entertainment, where enhanced features are often celebrated. The Brazilian butt lift (BBL) phenomenon. The Brazilian butt lift (BBL) has become one of the fastest-growing cosmetic surgery procedures, gaining widespread popularity over the last decade. This phenomenon can be examined through its popularity, cultural influence, procedure, risks, economic dynamics, and social implications. Cultural origins. The BBL originated in Brazil, where cosmetic surgery has a rich history. It gained traction in the United States, particularly in Miami, influenced by South American beauty standards that emphasize a curvy, hourglass figure. Media and celebrity influence. The rise in popularity is partly due to the influence of celebrities and social media, which have popularized the aesthetic of larger, rounded buttocks. This has shifted mainstream beauty ideals towards those traditionally held by Black and Latinx cultures. Procedure and risks. Surgical process. The procedure involves liposuction to remove fat from areas like the abdomen and thighs, which is then injected into the buttocks to enhance volume and shape. High risk. Despite its popularity, the BBL is considered one of the most dangerous cosmetic surgeries, with a significant risk of complications such as fat embolism. This occurs when fat enters the bloodstream and can lead to fatal outcomes. Safety improvements. Efforts to improve safety have led to new guidelines and techniques, such as superficial gluteal lipofilling, which aims to reduce the risk by avoiding deep muscle injections. Economic and social dynamics. Cost considerations. The procedure can be expensive, often leading individuals to seek cheaper options abroad, in countries like Turkey and Mexico. However, this can increase the risk due to varying standards of care. Recovery and aftercare. The recovery process is extensive and often requires specialized care. Many individuals opt for recovery houses, particularly in Miami, where they receive support during the healing process. Social and ethical implications. Body image and identity. For many, the BBL is a way to enhance self-esteem and conform to desired body standards. However, it also raises questions about the commodification of certain body types and the impact of societal pressures on body image. Cultural appropriation. The trend highlights issues of cultural appropriation as features historically associated with Black and Latinx women are commodified and celebrated when adopted by others, often without acknowledging the cultural origins and implications. Conclusion. Overall, the plastic surgery phenomenon is shaped by a complex interplay of technological, cultural, and psychological factors, reflecting broader societal trends in beauty and self-perception. As cosmetic procedures continue to evolve and become more accessible, it is essential to consider the ethical and social implications, ensuring that the pursuit of beauty does not come at the expense of diversity and inclusivity.